Yo, the lies so that you never make it. Hopeless, so it seems. Eyes closed, hands open wide, so it breaks your dreams. Sometimes you gotta take a loss just to get the win. Like lots of sin was popping in like oxygen with boxes with. Fundamental, never lose like smooth instrumental. Better tunes on the move and a pen go true. What I get to, never lose hope for the move for the set. Never give up and we better than me. We just keep winning, we conquering daily. Envision that pay me gets never this way. Be indigenous, maybe we winning this race. Your opportunity, 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 your opportunity. They moving it up like a man in a major. The focus is heavy and deadly.
Hey, Sarah.
Hey, how's it going?
Good. I've got Bones here. He's kind of relaxing in his little chair, just
Hi,
saying.
Bones. Good to see you
But
again.
he is with us. So just to let you know. All right. So thank you so much for joining us tonight. And I really just want to get straight into the topic at hand. And that is Mental Health Meds 101. As we know, it is Mental Health Awareness Month. Yay! And you, as a mental health nurse practitioner, have so many valuable different tips and tricks that I think you can really pass on. And so I'm just going to go through some questions that I get asked quite a bit. And please chime in with questions I know you get asked quite a bit, because we want to make sure that we are always getting out resources and making sure that people understand about their care. So our mission at Doing Well is we are increasing health literacy and access to care. We want to make sure that you know how to take care of yourself and you understand what's happening. So let's just dive right into it. So Mental Health Meds 101 are, actually, before we do that, I want you to brag about yourself just a little bit and tell everybody what you do.
Sure. So I'm a psychiatric mental health nurse practitioner. That means that in the state of Texas, I went to school to be able to diagnose and treat mental health disorders. I can do most of the same things a psychiatrist can do in the state of Texas with a few limitations. Nurse practitioners in Texas can't prescribe psychotropic medication for like ADHD, so psychostimulants. But we treat a ton of other things, and we treat ADHD with different medications. I own a clinic in New Braunfels, so I own Affective Mental Wellness, and we have 3 providers who treat a wide variety of patients. We work with a ton of educational resources like our school health advisory council in communities and schools to help increase health literacy and access to care for patients here in our area in the state of Texas.
That's amazing. Thank you so much. So let's dive right into it. So a mental health med is not a mental health med is not a mental health med, right? And so many times people are like, I'm on something for depression and I'm on something for anxiety and all the things, right? So let's just start off with the basics. Give us some basics around mental health meds as far as in an antidepressive state. Let's go through those first.
Sure. So depression's super common, and it's super common in a lot of different age categories. So all the way down to kiddos like 6 years old, all the way up to adults in their 90s suffer from depression. And there are a lot of different kinds of depression, but primarily when we prescribe antidepressant medication, we're talking about a couple different neurochemicals, serotonin and dopamine. So serotonin, norepinephrine, and dopamine. So when we're looking at prescribing medications to treat depression, we're looking at medicines that affect serotonin, norepinephrine, and dopamine. And we do that through several different kinds of medicines. Antidepressants can range anywhere from something called an SSRI, or selective serotonin reuptake inhibitor, even to include things like atypical antipsychotics that we use to help the SSRIs do their job. So some really common medications people have heard of are like Prozac. Prozac's a really common antidepressant that pretty much anybody who has depression has probably been on at one point or another. And that's just a selective serotonin reuptake inhibitor. So what Prozac does is you take it, it works in your body to help make more serotonin available for your brain. And what we're pretty sure happens is that when you have enough serotonin, you don't feel as sad.
So are there natural ways that you can get serotonin? Because when, as a patient, should you say, I'm going to try to treat myself naturally, and I'm going to go ahead and go get a prescription? When should you know the difference?
So that's a really great question. When you have started to look for a psychiatric provider, it's probably time to start taking a medication. Most people don't feel a little twinge of depressive symptom and go, oh, well, time for medications. Most people are going to try to get their serotonin naturally by like hanging out with friends, working out. There's a meme that's like, okay, I stood out in the bright sun and I drank the water and I ate the green things and I'm still not happy, you lump of mud. Make the chemicals. So we can do all of those things naturally. We can, make sure that we're getting plenty of sunlight, that we're getting exercise, that we're hugging people we love, that we're involved in activities we care about. And sometimes that's just not enough. I had a patient not too long ago who said, everything's going really well, and I still feel like I don't enjoy life. And it's like, oh man, okay, then let's look at supplementing some serotonin. Let's look at supplementing some of these chemicals so that even when things are going well, you can enjoy life. So that was for him the time and place where it was like, okay, we're ready to start looking at medication.
So when you're looking at, and let's just kind of stay on the antidepressants for a minute, what are some of the side effects that are good and some of the side effects that are bad? And can you mix and match with other medications? Like if you're on a antibiotic, sometimes people say, oh, I can't be on one medication because I'm on an antibiotic. Like, are there times and places that you need to pause that? So we'll start. I know I just asked you like 5 questions. So let's start with, what are the pros and cons of some of the side effects? Because one thing that we like to tell people, and I'm sure you do too, is that if a side effect, with medication, there's always going to be side effects, right? But if it's impairing your ability to function, then you need to speak up for yourself around that.
Absolutely. So there's nothing. So some of the major complaints people have about antidepressants are, one, weight gain. You're already feeling down, you're already feeling hopeless and sad, and like you can't feel and you can't pull yourself out of bed. And we're like, here's this medication that's going to make you gain 15, 20 pounds. And you're like, well, now I feel better, but I'm super upset about my weight. So weight gain can be one that is really impeding to people's day-to-day lives. So we want to make sure that when you're taking a medication that you're really having honest conversations with your healthcare provider about how much weight you've gained and how much you're comfortable gaining. There are medications that we can use that don't cause as much weight gain. There are medications we can use to help kind of mitigate that weight gain. So nobody wants to be on a medicine that causes them to, feel worse about themselves. We already feel bad. The other side effect that I think most people get really upset about, and this is kind of a more adult thing, is some sexual dysfunction. People kind of lose their libido. They're not interested in partners anymore. And again, if you want to feel good about life, one of those things that we look at holistically is, do we have a healthy sexual life? And does that mean that we're making safe choices, that we're with safe partners? And if we're not able to do that, if we're not able to have that adult connection, especially for, our more mature population, right, that's one thing that can really trigger increased anxiety, increased depression, and relationship problems. So again, there are other medications that we can take with antidepressants. Some of the ones that are better are like Trintellix, Wellbutrin, and I'm not making any recommendations to anyone specifically, but when I think about medications, there are certain ones that are less likely to cause the weight gain. There are certain ones that are less likely to cause those sexual side effects. I think one that doesn't get talked about a lot is when people start antidepressant medication, oftentimes they'll feel sick to their stomach and they'll have some nausea, some vomiting, even some diarrhea in the first couple of weeks. And this, Debbie, this blows my mind. So research has shown that our guts have more serotonin receptors than a dog's brain.
Wow.
So when we talk about our gut and we start taking these selective serotonin reuptake inhibitors, that's not just hitting the serotonin receptors in our brain, it's through our entire bodies. And sometimes our gut's like, whoa, hold on, you're messing with my cells. What are you doing? And then, after a week or two, that normally resolves. But if it goes on past a week or two and you're still having really significant nausea, vomiting, gastric issues that are, interfering with your life, with work, with your sports, with your relationships, that's definitely something I would say, hold on, let's talk to our provider and make sure that we're on a medication that's good for us.
And for those of you who don't know what a receptor is I always equate it to the game of baseball. And you have that person out there who's trying to catch the ball. So our brain, anytime you take a medication or you put something in it, you have these receptors that catch it. And that's how you start the functioning in your body. So when Sarah's talking about, we actually have receptors in our stomach that are catching the serotonin, which is really remarkable. Is there a time that you should pause taking your antidepressant? So say you are pregnant, say you've been diagnosed with a cancer or maybe something else, that there might be something that you need to pause it. Like, when should you have, and also when should you have that conversation? Who should you have it with?
Yeah, so that's another really great question. And thanks for bringing that up about receptors. Yeah, if you think about I love that analogy of being like a baseball catcher. So yeah, you've got the serotonin being thrown out and the catcher's like, gotcha. And your stomach's like, don't want you. So your stomach gets a little upset about it. That's a fantastic analogy. So there are some definite, very specific situations that you would want to pause taking your antidepressant medication. There are Black label warnings on antidepressant medicines that sometimes, in very rare cases, it can increase your depressive symptoms, especially so much that you might start having, trigger warning, some suicidal thoughts, some thoughts about maybe not wanting to be alive anymore. So that's a situation where I would say stop taking the medication. Contact your provider's office immediately. And if you need to, contact 911, or I don't know if everybody knows about 988, but 988 is a fantastic resource that you can text, you can call, you can get online and chat, and you can have a crisis counselor with access to a crisis counselor within 5 minutes. So if we start having an increase in those depressive symptoms, yes, stop taking it, talk to a crisis counselor, ER, contact your provider's office. If you are going to use excessive amounts of alcohol or illicit substances, drugs, alcohol kind of thing, sometimes it's really good to pause your antidepressant medication. For things like pregnancy, because that is a real thing, like as a mom of 5 kids, that's definitely something I've had to think about. Research has gotten really interesting lately, and we used to have these labels on psychiatric medication that was like, this is a category B, this is a category X, it's going to cause major problems. What research has shown recently is that stable moms make more stable babies. So it's really important, if you find out you're pregnant, that you let your provider know ASAP so that you guys can have a conversation and you can decide if the cost benefit is there to stay on your medication. It's very rare that we want you to just stop taking medicine. We always want to encourage you to have a conversation with a provider. And if you are not able to have that conversation with your provider, it's always better to take slow steps to come off of medicine versus just stopping it. Some of these medicines, especially some of the antidepressants, can have some really gnarly withdrawal effects where you have like brain zaps and feeling foggy. And again, stopping abruptly can cause you to have some of those increased depressive symptoms that can make you feel really, really bad. And again, with some of those thoughts that we really don't want you to be having, those 988, 911 thoughts.
Right. I love that you brought up 988. And one thing that you actually taught me about 988 is, and this is for anybody that's out there, is that if you are having a bad day, if you need some advice and you're like, oh my goodness, work is driving me nuts, you can text 988 and you can ask them questions. You can just say, do you have support systems in place, or what do you recommend? So it's not just a phone call for like, I feel like I'm going to harm myself, but it's also a really great resource if you are going through a depressive episode.
Absolutely. And they're happy to talk to you. Even when I have texted in when I'm doing like a lecture or a presentation and I just want to show somebody how it works, they're always, thank you so much for contacting us. We're so thankful that you were able to access our resource. It's free and it's confidential.
And I do want to say something too, is that if you do not know the type of med that you are taking, you need to look it up. You should always know the medication that you're on. Every medication has what's called an NDC number on it. So it'll have a little imprint. You can actually go on to drugs.com, poison.org. You can type in what the medication is. You can go straight to a Google search and you can put NDC and then type in all the letters that come after that and letters and numbers, and that will tell you the medication that you're taking. And you want to make sure, now how important is it to follow the label of what it says? So if it says take it once a day, if it says to take it twice a day, like what, and you're trying to save money, right? Because what do you say to that?
Sure. And that's again a really great question because some of these medicines are super like stupidly expensive. And, you know, if it comes down to being able to buy gas to get to work or buying food for you and your family, obviously that's going to be a huge factor. That's again a conversation that you really need to have with your prescriber. If your medication isn't something that you can access, it's no good. It's no good. And we as providers need to know that because there are so many medicines now. Walmart has a fantastic $4 medicine list. There are savings cards that we can get from our drug reps. Drug reps are people who come in and like give us new information about the medication and what it can be used for. And they help us get more information about how the medicine works as it gets older and older. And so they're really helpful with getting like savings cards. GoodRx is a great resource if you can't afford your medication. It's an app you can download that helps get you discounted savings on medications. But if you're not able to take your medicine as you and your prescriber have discussed, that's really a discussion you need to be having with the person who's writing your medicine. Again, some of these medicines, if you stop taking them or you take less of them than you're supposed to, you can have withdrawal effects, you can have really significant side effects, and you can have some really scary thoughts that we want to avoid. Of course, if you have problems, the ER is always, a resource, and they are required by law to provide stabilization. So if you are flat out of your medicine and you can't pay your cost to go see your doctor, there's also a mental health ER in San Antonio. And what I can do is I can get you the information for it, Debbie, because I don't have it off the top of my head, but I think it's called Sigma. And so it's like a mental health 911. You can go, you can get a quick refill on your medicine. And I believe they take insurance and work on a sliding scale. So it's really important to take your medicine as you and your prescriber discuss. And I want to say this about it too. I'll have patients who are like, I looked on Google and this isn't a medicine you're supposed to take for this, or this is a medicine you're only supposed to take like this. So we say that in psychiatric mental health care, it's more of an art than a science. So there are a lot of medicines that we give that maybe has a different classification. Like for instance, my kids take a medication called guanfacine or Intuniv. And when you look Intuniv up, it's going to say this medicine is used to treat blood pressure. And you're right. It is used to treat blood pressure, but it's also used in the psychiatric world to treat ADHD. So if I didn't know better, I would go home and look at this medicine and say, my psych provider is cuckoo for Cocoa Puffs. Why did they give me a blood pressure for my 11-year-old kid with ADHD? But I had a really good conversation with them about what that medication does and what side effects I should be looking for and the dosing for ADHD. So the Googs does not always have all the right answers. So you want to make sure, again, that you're really having that conversation with your prescriber and that you're reading every medication. And I don't know if you've done another video about this, has a package insert. That's like 5,000 pages long, that's in the tiniest of writing. You need like a magnifying glass to be able to read it. But it will come with that. You can certainly read through that and look for what's called its indications. So medicines have more than one indication. The other thing you can do if you have a question about the medication is ask a pharmacist. So your pharmacist, when you go to pick up your medication, pharmacists are required to have, now they're required to have a doctorate, and many of them have master's degrees. They are absolute experts in how the medicine works, what medicine it can be taken with. If you take a list to your provider and your provider doesn't know, ask your pharmacist. Say, hey, I'm on this medication. I can't really afford it. What are some ways that can I cut this one in half? Because there are certain medicines that you shouldn't cut in half. Can I take this one every other day? You know, and they might be able to provide some guidance on that, again, if you're not able to get into your provider.
I love that. And then also it will tell you on there too, if there are certain foods, drinks, fruits. I know sometimes grapefruit can be one of those that to warn. Yeah.
The really nice thing about most antidepressant medicines, about most of the medicines we give, is that there aren't a lot of restrictions. There are a couple of classifications that most providers now really don't like because the medicines just don't play well with others. And you know, we want a big friend group, we want a big medicine group that plays well together. So most of the medicines that we prescribe nowadays don't have a ton of interactions. So you do want to make sure, again, that you're asking that pharmacist, you want to make sure you're looking at your pill bottle, and you want to make sure you're following the instructions. So if it says take this medicine with food, you want to make sure you take it with food. There are a couple of different medications that we use for mood stability that you have to take with 350 calories. And if you don't take it with 350 calories, it's not going to work the way it's supposed to. So you want to make sure that you're reading that information, that you have the right information, and that you're taking it as you and your prescriber have talked about.
So that would be a good meal that you need to take the medication with.
Yep. Yeah. 350 calories. And some people are like, a cheese stick. No, that's like 80 calories. So we need to make sure that we're not only reading our drug labels, but we're also reading some of the food labels. Certain medications in a couple of categories, MAOIs, they don't like playing with some foods. They don't like playing with some medicines. So we just want to make sure that we're aware.
How long does it typically take for a medication to kick in? And, you know, and this is the thing is people are like, I've been on this for 2 weeks and I still feel the same. And sometimes that's the hard part is like, just stay with it. How do you know you've been on it for too long and it hasn't been working?
Yeah, so that's another really great question. And this goes down to receptors. So if you think about like the outfield of a baseball game, you've got, and I don't watch baseball, so I'm going to be really bad at this analogy.
Yeah.
You've got,
we're both in the same boat. So.
Okay. So if you've got 20 outfielders and you're throwing like one ball at a time, it's going to take a while for all 20 outfielders to be holding a ball. And that's when, you know, that's kind of what we're looking for is more receptors to be able to, you know, catch the ball and make more of that serotonin available. Most of the time with antidepressant medicine, we're looking at like 4 to 6 weeks. And that's a long time to wait, especially when you're feeling so low and so down. That's when things like, sometimes we give people medicine to help them sleep. Sometimes we give people medicine to help with anxiety that acts very, very quickly, because we're waiting for that 4 to 6 weeks to kick in, for that medicine to be able to kick in. But, depression really rarely comes by itself. Oftentimes it comes with anxiety, it comes with, problems sleeping, it comes with panic. And so we want to make sure that we're helping manage those symptoms until that medicine starts working.
So since you talked about anti-anxiety, let's jump over there.
Yep.
So let's talk about anti-anxiety meds. What are some of the most common ones? What are ones that people usually confuse as an anti-anxiety med, but it's really not?
Yeah. So again, this is where that classification of anti-anxiety, antidepressive medicine. I don't know if I've mentioned, I hate the way that psychiatric medication is classified. So when we talk about antidepressants, most of the time we're talking about SSRIs, or those selective serotonin reuptake inhibitors, SNRIs, which is norepinephrine reuptake inhibitors, or like dopamine, norepinephrine, things like Wellbutrin. The gold standard for treating anxiety is using an SSRI. So what we know about brains is that serotonin really helps decrease anxiety levels also. There was a long time that people were getting medications for anxiety that what we've found out is actually really bad for your brain. So some older providers and now providers used to write anxiety medication like Xanax, Ativan, Valium, and they would ask people to take it several times a day for a really long time to help with their anxiety symptoms. What we know now is that those don't really help with treating the anxiety. It just kind of helps cover it up. On top of that, taking it for long periods of time can cause problems like dementia and Alzheimer's, is what the research has shown recently. That's not to say there's not a place for things like Ativan, Xanax, Valium. And some of the times while we're waiting for that antidepressant medicine to work, that SSRI will give a short-term Xanax, Ativan, Valium to get you through, because we're like, we get that you really need help. So we're going to give this for short term to manage the symptoms while we're waiting for this other medicine to help. But really what we want to be using those medicines for is not long-term management of anxiety. There are medicines that we can give what we call as needed. And I think this is really important. SSRIs are never as needed. They are always going to be a daily medicine.
Yeah, you were touching on something I was just going to ask about, and I really want people to pay attention because that is such an important part. So when we say as needed, we're talking about like, oh my gosh, I'm super anxious. What am I going to take? And popping one. So yeah, so dive into that.
Yeah, so a lot of people experience what we call like episodic anxiety, or something really triggers this anxiety episode. Like, oh my gosh, in nursing school, taking tests, I was like, and I know a lot of kids, like high schoolers or junior high students, who are like, the STAR test comes up and they're like, or people are getting ready for a job interview, or, they have to go visit a family member that's really triggering. And so taking a medicine as needed before you go into that situation can be really helpful. And that's sometimes when flying on a plane, oh my gosh, pop a Xanax before you get on your flight, sleep through it, get off, you're fine. That's for like that panic, really like specific induced anxiety. And so that's a very appropriate time to take an as needed medicine. Some other as needed medicines that we give don't fall into the category of what we call benzos, which is like the Ativan, Valium, Klonopin, Xanax. So there are other medicines that we can give that are as needed, or what your provider might say is like PRN. So we give them as needed. One of them is propranolol. And that's actually a beta blocker, a blood pressure medicine that helps tell your heart, like, hey, calm down. We don't need to be racing. It tells your blood pressure, like, hey, no need to have a stroke right now. Let's settle down. And when it settles your body down, it sends a message to your brain that's like, we're not dying. You can calm down. And your brain's like, oh, got the message. No problem. Another medicine that we give as needed is called hydroxyzine. And actually, hydroxyzine's a cousin to Benadryl. And I don't know about you, but when I take a Benadryl, it's really hard to be bothered by allergies when I'm passed out on the floor. So hydroxyzine's just like a Benadryl light. It just kind of helps take the edge off a little bit, makes you a little floaty. It's non-addictive. It's not going to cause you to be impaired while you're driving. And it's just like helpful when people are in school needing to take a test and they're still needing to be aware in their brain, but they also need a little bit of help taking it down a notch. So those are some of those as needed medications. Things like Ativan, Xanax, Clonidine, Klonopin, and Valium. Those are things that like we want to make sure we're not driving a car or drinking alcohol when we're taking those, because it's really unsafe. Those medicines mixed with other things can send your brain a signal that says, we don't need to breathe right now. We're that relaxed. And while we want you to not be anxious, we don't want you to be so relaxed that you forget to breathe. That's a really important reaction that we
It's a
want.
minor detail.
Yeah, so those are some of those as needed things that we can give. And again, those two different categories of like, we've got these benzodiazepines that we want to be really careful with. And then we've got like the non-benzos that we can use that are really helpful, that just tell our brain a different story and they tell our body a different story that also help reduce the anxiety. But going back, the primary medicine we use for that anxiety is the antidepressant medication, that SSRI.
What about people that say just breathe into a bag?
Those are the same people that say, like, maybe try lavender oil. And while I agree, sometimes lavender oil and breathing into a bag can be useful, sometimes our brains just really don't care if we're breathing into a bag. Again, you breathe into a bag too many times, you're going to be unconscious on the floor. Sometimes our brains just need a little something extra. And while breathing into a bag might help some people, mindfulness helps people. Other people have brains that just need a little something extra. And, you know, the shirt says, if you can't make your own serotonin, it's okay to get store-bought. This is no different than like if somebody has insulin and their pancreas is like, I'm not making insulin anymore. We go ahead and supplement that insulin. It's not that there's something wrong with the person. It's not that they're broken. It's not that they're defective. All of these signals happen in your brain. And when your brain's not making the right chemicals, we supplement those chemicals. We adjust the brain chemicals to give us the results we want. And that there is nothing wrong with that. And, you know, it being Mental Health Month, the stigma is so bad with mental health. And I tell this joke kind of silly, like as a silly thing. My husband is literally a philosopher. If you've seen The Good Place, I'm married to Chidi. So if you haven't seen The Good Place, it's hilarious. But philosophers have this whole thing where they talk about the mind-body problem and, you know, what is our mind and what is our body and how do we separate it? And, you know, is it something that we can say for certain, you know, all of these things happen because you are a bad person, because you just need to take deep breaths more? And have you tried going for a walk? No. Sometimes your brain is just not doing the brain thing and we need to help it. And that's okay. That is more than okay. I guarantee, Debbie, that if people thought about like, oh my gosh, my family's going to be ashamed of me if I take mental health medicine versus what's going to happen if I don't make it out of this depressive episode? What if I don't make it out of this anxiety? Right. Your family, your friends, the people you love would so much rather you take a medicine than the alternative.
I 100% agree. I do think we need to remove the stigma, right? And we need to chisel at it and work at it. And I love that you said you know, if your body doesn't make enough insulin, then we give you insulin. And sometimes it is not just enough. I know, I love that you talked about propranolol. That is something that is given to people quite a bit if they're getting ready to give a speech. And I know actually I was doing a panel not too long ago, and I was walking around and talking. It was one that you were at, Sarah, and I was having a good time. But I sat down and all of a sudden my Apple Watch had a high heart rate alert on it. And so, yeah, so those are those things when you are you don't realize it, the anxiety that can come from, public speaking or whatever that looks like. So I want to shift over into ADHD meds and just kind of let's run through what that looks like, because I also feel like there's a lot of stigma around that. And
Yeah.
when you are and there's something that I want to say right now before it flees my mind, is that and we will probably say it again at the end, is that if you are listening to this and you're like in college, or you're just feeling anxious or whatever, that you're like, I'm gonna pop an Addy because I want to stay up all night and focus to get a test done or whatever, and you go to somebody who sells it to you, what they are telling us right now is, if you do not know that that came from a pharmacist, if you do not know where that medication originated from, assume that there is fentanyl in it.
Yep.
And that it is on the rise right now. I cannot specify how dangerous it is for people right now. So I just want to make sure that because I know that people are like, I want to find something for my anxiety. And they're like, I have a friend who can come help you. So
Yeah, yeah. And I really am glad that you brought that up. If it's anxiety medicine, if somebody's like, I got you a football, street Xanax, assume it has fentanyl in it. And it does not take much fentanyl. If you don't know what fentanyl is a pain medicine that tells your brain to stop breathing. So fentanyl is killing a lot of people. If you don't have access to mental health to medication, reach out. Link in bio. I don't know what that looks like, but I know myself and my clinic, we are more than happy to help you get medication safely. If we're not the right fit for you, we can help find you the right fit. Please don't take medicine that you have not directly gotten from the pharmacist for you. Again, this goes back to taking the medication as directed that you discussed with your prescriber. If your prescriber is John that stands on the corner of Broadway and 32nd, that's not a licensed pharmacist. Please don't. Yeah. And so going back to the ADHD and the stigma, I'm a product of the 80s, and there was such a push for ADHD medication at that time that I think me and most of my friends at some point were given Adderall by our pediatricians to try, just in case we had ADHD. I took it for about a week and was like, this is awful. I hate it. ADHD is a real thing. And I'm going to say something that's a little bit backwards. It is underdiagnosed and it is overdiagnosed. There is a specific criteria that you need to meet to be diagnosed with ADHD. ADHD does not end when you turn 18. ADHD is a problem with something we call executive functioning. So executive functioning is like waking up and being like, okay, I know the first thing I need to do is go to the bathroom. Then I'm going to brush my teeth and take a shower and put my clothes on and get everything that I need together for work. That's going to be my laptop, my charts. I need to make sure I have keys to my clinic. I need to make sure I have my coffee. I can do all of those things without 14 reminders, without a list, without a chart on my refrigerator. I have executive functioning to be able to wake up and do that. People without executive functioning missteps. They have a hard time focusing. They have a hard time paying attention. Maybe they have a hard time in class. They lose things frequently. We joke at the clinics, it's like, look, a frog. I like chocolate. Why is France so far away? So what we do is we give stimulant medication. If that's a stimulant like Adderall, Concerta, Ritalin, or if it's a norepinephrine reuptake inhibitor, we've talked about that norepinephrine piece. Norepinephrine helps with this also. So Strattera, Quilbry. And then there are a couple medicines we use just to take that intensity level down a little bit, like Intuniv. That's the blood pressure medicine that my kid's on. But this medication should be taken, again, as you've talked about, with your prescriber. Some people need more than others. Some people take it once a day and they take a long acting. Some people take it a couple times a day, depending on what their job is or where they are in school or work. So that's all really relevant to ADHD. The other thing with ADHD is a little bit controversial, and that's because, prescribers used to say, well, you can take weekend breaks and you can take breaks on summer vacation. Learning how to executively function doesn't stop on the weekends, and it doesn't stop over the summer. So when we take breaks from those medications and our brains stop learning how to executively function, we go back into the week, or we go back into the school year, or we go back into the work situation, and our brains are like, you want me to what? Look, a frog. I like chocolate. Why is France so far away? So while it's not as dangerous to take breaks from your ADHD medication, it's not given to help control your behavior. ADHD is given to help make sure that you develop skills to function executively, to develop that executive function, so that you can put tools into place like reminders on your phone, like calendars, like graphic organizers, like checklists, any of those things. And some of the side effects from ADHD medications suck. Weight loss, significant weight loss, especially in kiddos. People with high blood pressure might have a harder time with some of those stimulants. Sometimes it increases anxiety. And then we're given, you'll have those old prescribers that'll write you for 30 of Adderall and 2 of Xanax. And it's like, wait, there are so many kinds of stimulant medications we can give for ADHD. What we need to do is find the right one. So again, if you're having those side effects with your ADHD medication, talk to your prescriber, try something different. Just because one doesn't work, it doesn't mean they're not all going to work.
I want to go back to something that you said that I have found highly irritating is in some adults, their ADHD medication has been paused because of drug or different health insurance companies are like, oh, we need to make sure that it's that you actually have it, or we're waiting to get blood drawn. And so can you walk through that? Because the adults I know who have gone through that, it has been crippling for them. And it makes me angry, because when they know that they need it and they want to be high functioning, and these are people that need to be high functioning
right
in the workplace.
Yeah. So a couple things happened recently that really impacted access to ADHD medication. So there was already this huge stigma about ADHD and grownups. And it was like, well, you're not in school anymore. Why do you need to have executive function? I don't know, because I have a family, because I have a job. Like life didn't stop because I'm not pediatric.
Because I'm living. Yeah.
Right. So there was already this stigma about ADHD being a kid's diagnosis. And so prescribers, especially family practice prescribers, really have a hard time prescribing stimulants to adults. Then during COVID, 2 really interesting things happened. During COVID, there was a huge pop-up of telehealth companies that were like, do you think you have ADHD? Take our quiz in 15 minutes and you can have medication shipped right to your door. And what we had several different companies who had people doing what's called practicing outside of their scope. So this would be practicing out of your scope looks like this. A dermatologist does skin. That's what they do. That's what they're supposed to do. And so you go to your dermatologist to treat your skin. If your skin doctor was like, I think I should perform open heart surgery, you would be like, wait, what? No, I just need you to check this mole, not cut my chest open. They would be practicing outside of their scope. So there were a bunch of people who were family practice, but not specialist in psychiatric healthcare, that were diagnosing everybody under the sun with ADHD, and they were overprescribing stimulant medications. This gave the DEA, or the Drug Enforcement Agency, who were the people who authorize how much stimulant medication can be made, they were like, woohoo, red flags, we don't like this. And so they shut down a couple companies. They flagged them, they gave them license suspensions and made the company shut down. But then what they also did is there were a couple drug companies that couldn't make enough of the medication. So the DEA is kind of like the treasury for drugs. And they say, okay, Concerta, you can manufacture this many Concerta pills. You can make this many Ritalin pills. And when people who didn't need the medicine were getting it, the people who needed the medicine couldn't get it. So that one decision that some companies made really impacted things a number of different ways. Then we also have this problem now where people are like, well, I had an Adderall prescription. Why can't you give me Adderall? And so now specialist providers who are practicing inside their scope, who are licensed to diagnose and treat ADHD as a specialty, have to say, well, while we acknowledge you have some problems focusing, it might be related to these other things that kind of look like ADHD, but Adderall isn't your answer. So now we're having to kind of go back and correct the problem. And what that's done is that's really impacted the stigma. And people are like, oh, people just want Adderall to be able to stay awake to get projects done.
Yeah.
And
Yeah.
that's not the case for everybody.
And, you know, and I do want to bring that up too, because I know if you are in school or if you have a big project and you know somebody who's been prescribed Adderall, please give them grace if they are like, I can't share my Adderall because it is so regulated and it's going to put them in a bind when they actually need it on a daily basis to function.
Right.
That you want to make sure that they are getting what they need. And again, it's, you know, the meds, all the meds that we talked about, the mental health meds, it's not, you know, we deal a lot with patients that are sharing blood pressure medication and, you know, and so these medications are specific to you. It's not about going out and sharing it with your friends and sharing your, you know, hey, try this antidepressant, it works for me. But knowledge is power, and you should know every single pill that you're putting inside your body. You should know the name of it. You should know the dosage of it, and you should know what it interacts with. And also, does it make you feel nauseous? Like sometimes we'll say maybe take a medication before you go to bed at night, you know, but does that also inhibit some of your functioning? So you really want to, I love, Sarah, that you talked about talking to your pharmacist is absolutely powerful. And I would say Dr. Google can sometimes harm the mission moving forward. And you want to make sure that you are getting your information from reputable sources. And we will put information for you in the show notes as well about how to reach out and different websites that you can go to that you can access for your mental health meds.
Absolutely. Sharing is caring, not with psychiatric medication, please.
Yeah. Anything else that because I feel like this is something we could talk about for hours, but is there anything that you can think of that is one of those questions that you get asked about a lot? What are, you know, I know we've talked about even doing an ADHD video is separate. For those of you who are interested in ketamine, Sarah and I did 2 ketamine videos that we'll link for you on the channel as well, which are really important. And I would like for you to also just say very quickly some of the street meds that you are seeing out there that are like, quote, a Xanax or something like that. What are the names of those street meds? Because I want to make sure I am all about, we have got to get these names out in front of people so they realize that they are from the street, not from a pharmacy.
Yeah, so I actually am not great with street names because most of my clients just tell me exactly what they're looking for. But I know some of the ones like when you're talking about a football, you're talking about Xanax. When you're talking about Adderall, you're going to be like Addies and Up, 7-Ups. What are some other things? I honestly don't know right off the top of my head some of the street names. But here's the thing. If it's not prescribed to you, don't take it, regardless of what it's called, because again, you don't know what's in it. I mean, this could be Steve in his basement with a pill compressor that's putting together horse tranquilizer mixed with vitamin D. You don't know, mixed with fentanyl.
Yes.
Who knows? It could be dirt from your backyard. You don't know unless you're getting it from a pharmacist. Assume it's not what you think it is.
Yeah, and we do a lot of Narcan education, and we talk about what that looks like for fentanyl overdoses.
Yep.
And it only takes, so those of you who are at home right now, go look at your salt. It only takes about 12 grains of salt. And that is the equivalent of what will kill you, the amount of fentanyl.
With
So it
fentanyl.
is absolutely, absolutely lethal. So,
And people are mixing it because they know it's very addictive.
yes.
So just like if you like Bluebell ice cream specifically from HEB, they know they've got you hooked on that Bluebell ice cream. So if you like what you're getting because it makes you feel good, something we say about addiction is it's hard to get enough of something that almost works. When you keep going back to that person, you're giving them business again and again and again because you like the way it makes you feel. Totally understand it. It's so imperative that if you're going to do that, that you're familiar with Narcan, that you have Narcan available, and that you talk to the people around you about how to use Narcan if you do decide to use. Obviously, the best choice is to not use, but understanding that life happens, Narcan is so, so, so important to be familiar with because it can literally save your or a friend's life.
And we're going to be posting up a video very soon on how to administer Narcan.
Cool.
And also look for all this information in the show notes as well, so we can get you everything in that you need. So,
Perfect. Yeah, I would say
Sarah, thank you so
don't take
much.
anything that's not prescribed to you. Don't stop taking anything that is prescribed to you. Talk to your prescriber and end the mental health stigma.
Yes, for
Ah.
sure.
Debbie, thank you so much for having me.
Yeah, thank you. And Bone says thank you.
Thanks, guys.
And we will see you later. All right.
Sounds good.
Good night. Bye. Stay well, everyone.